This podcast is centered around the mental health disorder PTSD, which is the acronym for the condition known as post-traumatic stress disorder. I will define this disorder as outlined by the relevant literature, as well as describing complex PTSD, and will describe the signs and symptoms most commonly observed in both, and link these to the best practice treatment outlined by the NICE guidelines of 2022. NICE being the National Institute for the Health and Care Excellence. Having discussed treatment, I will also clarify strategies for maintaining safety in managing areas of care, concentrating on risk assessment, continued monitoring, and areas of self-help. These strategies for self-help and risk assessment can be found in the reputable and research-robust organisations such as UK Mind and the Samaritans. The podcast is not a definitive attempt at overseeing this mental health issue, but will endeavour to clarify the main points of definition, treatment and risk assessment related to it. Further reading and information is available with the accompanying reference list. Margaret Howe in 2014 defined PTSD as the development of symptoms following an extremely stressful experience or situation. It differs from other anxiety disorders because of its specific causation. The traumatic event is usually experienced through recurrent and intrusive recollections, images, thoughts, or perceptions. Distressing dreams and nightmares also occur, and there is often persistent avoidance of anything associated with the trauma. A person with PTSD, as I have said before, often relive the traumatic event through nightmares and flashbacks, and by doing so experience profound feelings of isolation, irritability, and guilt. These symptoms can have a profound effect on day-to-day life. It is thought that the causes of PTSD are many and varied, and can include road traffic accidents, accidents in general, personal assaults, robbery, childbirth difficulties, and health problems and disorders. And as a nurse, I have seen in the clinical area individuals exhibiting PTSD, post-spinal cord injury, post-admission to intensive care, and in a result of a traumatic grief reaction after a death of a loved one. It is said to occur weeks, months, or even years after the event, and can affect up to 30% of a population. Complex PTSD is a reaction to people that repeatedly experience traumatic situations and abuse. Symptoms are similar to PTSD, however, may not develop until years after the event. Complex PTSD can include those with graphic military experiences, asylum seekers in 2018, childhood abuse cases also. People suffering complex PTSD can also exhibit severe negative self-perceptions and feelings of worthlessness. Identifying risk in PTSD is vital, and information given by NICE centres not only on medical and health personnel, but on the individuals experiencing PTSD symptoms and their families and significant others. NICE Guidelines 1-1, recognition of post-traumatic stress disorder, states that people have the right to be involved in discussions and make informed decisions about their care. It is important to be aware here that PTSD can be successfully treated. Being aware of the length of time symptoms may occur is vital here and needs to be comprehensive. There needs to be a comprehensive watchful waiting time where a long-term assessment period can be implemented. This watchful waiting period can be medical or self-monitored, and this monitoring needs to be active in nature. Antidepressants can be beneficial, especially by people waiting or wanting medical treatment, and talking therapies can be beneficial too. It is important that people understand potential triggers to their condition, such as situations, words, images, and events. Support and information are available not only via NICE guidelines, but by the following organisations: Combat Stress, Rape Crisis, Victim Support, CRUISE, Mind, NHS Health, and the Samaritans, and all links can be viewed in the accompanying reference list. So it is important that people who have experienced a trauma be monitored for clinical PTSD, but there are people that may be deemed more at risk, and these are people with existing depression, people with limited support structures in the community, and NICE indicates there may be a genetic factor involved, such as parental mental health issues. PTSD develops, it is thought, when flashbacks occur in order for the individual to process the trauma, so that further trauma can be coped with. It is also important to note here that people with alcohol and drug misuse issues must not be precluded from the assessment, as they may be using these substances to treat symptoms themselves. High adrenaline levels have been found in patients with PTSD, and these people who have been described, or has also been described as exhibiting hyperarousal or feelings on the edge. Other people may exhibit emotional numbing, where the difficult memories are pushed out of the mind as a way of coping. It has been previously stated that treatment can be successful with people suffering from PTSD. Talking therapies include CBT, may be indicated. EMDR therapy, especially as NICE understates that 1 to 3 months post-trauma, this is advocated. EMDR, or eye movement desensitization and reprocessing, involves making rapid eye movements while recalling the traumatic episode. The BACP states EMDR helps you process the negative images, emotions, beliefs, and body sensations associated with traumatic memories. Medical treatments for those having a preference for drug therapy may be candidates for drugs such as venlafaxine or sertraline. Mind advocates teaching grounding with sufferers, therapies that connect the person with the present day, and also use of diary journals can be useful. Generally, strategies such as mindfulness and being taught to comfort yourself with things like treats, physical contact, use of pets can also be deemed clinically effective. And so, in conclusion, PTSD is a condition that can be treated. It is important that a full risk assessment be ongoing with people who have suffered trauma in all these guises, and ongoing for several years after the event. Modern day disasters, survivors of disaster asylum seekers have recently been added to the assessment criteria in 2018, and it's important that symptoms may only appear months and years after the trauma has occurred. Treatment can be medically and psychologically led, and the guidelines as outlined by NHS Health and NICE are unambiguous and clear.